So we are currently on break. Hi Nadia.
Hi.
How are you feeling?
Tired.
Okay.
Hungry.
Okay, and this is Jennifer.
Hi.
How are you?
Good. Wanna
Okay.
go home now.
Go home? No way. You still have 6
How
hours.
many hours more? 6?
Yeah. So guys, I just woke up and I'm about to go get my shower. As you can see, it's about 5 a.m. So guys, this is what I'm having for breakfast. I'm on my way to the hospital and I'm going to see you shortly. So guys, I am all dressed up in my scrubs and I got to the hospital at about 6:30 a.m. I have to meet with my clinical instructor by 7 a.m. So she's going to assign me to a patient and to a nurse, and later on I have to meet the nurse so that I can get a summary, like a little background of how my patient is. And so when that is done, I will check like the software that we use, EPIC, EPIC, to read more about the patient. Then later on, I'll walk into the patient's room, introduce myself, check 2 identifiers, and check the vital signs, perform a head-to-toe assessment, check the medications of the patient, and I'll have to check to see if the patient needs medications before breakfast or so. And when that is done, I can give the patient a sponge bath or a shower. And so we have 2 breaks. One is in the morning and one is in the afternoon. So I can get my first break by 10 a.m. and the second one by 1 p.m. But I have to look for someone to cover me up while I am on break. So I always choose any of my classmates. So another thing I have to do is documentation. And also when giving medications, we have to make sure that our clinical instructor is beside us, just to ensure we are doing everything properly. Common medications to expect on the oncology floor in the hospital is hydromorphone, ceftriaxone, pregabalin, cefazolin, vancomycin, methadone, codeine, Gravol, pantoprazole. You have to assess the patient after 1 hour, 2 hours, or 4 hours, depending on the patient's condition. So on the oncology floor, you get to perform dressing changes. You can witness PICC line insertions, and sometimes you can experience procedures such as paracentesis, drains, wound care. So currently the problem I'm facing is critical thinking. Like I still have to work on critical thinking, documentation, and sometimes like I have to get things in control rather than asking the nurse all the time or calling for the nurse or paging the nurse. I still have a lot to work on, and one advice I would love to give you guys if you're starting your clinicals is listen to your clinical instructor, because she's the one who is going to evaluate you. And that's all I have to say for now, and please let me know how your clinical placement is going.